Hello, everybody, people. They speak English in our pages, is in our channel. As I told you before, every Wednesday we will talk in English in the NPR podcast. We will talk today on something very interesting, that is T.M.J's and rehabilitation. It's a very nice topic that we can see that is important to understand for rehabilitation people, that is necessary to have a big concept in the integration of our topic. And I will share some little PowerPoint just to introduce you the topic. T.M.J is, as we said in our school, that is not just T.M.J's. It's a very important part into the craniofacial system. Craniofacial system is our main system, but is also our main disturber in the posture. And that's why it's very important to understand that we need to know this particular connection between the craniofacial system and the rest of the body. Why I am telling that? Because most of the people who follow us in our school is people who do rehabilitation. But when we talk about rehabilitation, we talk about just physical rehabilitation. But if we are a dentist, also we are doing craniofacial rehabilitation, and it's very important to have a good balance between the whole body to have a good result without interferences. That is the important thing that we have to take as a focus. NPR is an interdisciplinary protocol, as you know, is an interdisciplinary protocol who put all the medical science to work together in an holistic treatment. Today we are talking about T.M.J's. T.M.J's is a topic that we know very well because it's very, very well known. Everybody around the world know T.M.J's or T.M.G, temporomandibular disorders. But temporomandibular disorders is not just a disorder of the T.M.J's. Most of them have to do with the occlusion, with the jaw position, with the craniofacial balance, and with the postural balance. We cannot have a good rehabilitation if we don't have a good balance in the whole body, craniofacial system, neuromuscular balance with the rest of the body. And that is a very important topic because we cannot have a good rehabilitation, local or holistic, if we don't have a good balance between craniofacial system and the rest of the body. Why? Because when the jaw position is losing the centric position, we call that relationship, centric relationship. If we lose it, that can start a big problem into the T.M.J's because it's increasing the pressure. And as you know, we're talking about that many times in our school, that the pressure increased into the T.M.J's create a problem. And in that moment, the sensorial receptors will start a defense. The defense is the bruxisms. And the bruxisms is creating a bad situation into the craniosutures, into the neck, and chronically into the whole muscle chains. And that's why we have to have balance between all system. We say balance between craniofacial system and tonic postural system. Don't forget it. I insist on it because that is the key of the result. With the rest position with the rest of the body, balance with the rest of the body. That is the goal. That is a very important goal. And we have only that if we have a good interdiscipline. We cannot treat TMJs only as a dentist. We cannot treat TMJs only as a physiotherapist or an osteopath or a doctor. We need the interdiscipline to treat that particular disease that is not TMD, is craniofacial dysfunction. Interdiscipline is the goal in our treatment. Don't forget it ever. Prevention is the key. Why I'm saying that? Because to have a good balance, we have to prevent the disease at the beginning. And the prevention is when the childs are growing. This is the real prevention. When the childs are growing, in the age of development, we can prevent in an adult the problem. That's why it's very important, and a specialty in dentistry, that is the craniofacial orthopedics. The craniofacial orthopedics deal with the growth of the child to have a good adult human being. Craniofacial orthopedics is prevention. Don't forget it. When we are treating patients in the early age, we will have a good growth, a good balance, and we never will have problem in the future. But not only that, imagine to have a good rehabilitation is not only the dental treatment. We have to deal with the biochemistry of the body. Why? Because intoxication is creating also a bad function in the muscle chains. And what happens? If we have a bad function in the muscle chains, we will have a very bad neuromuscular reaction. How you can do a good rehabilitation if you don't take care on it, even locally? T.M.J's anatomically is a joint, but having a lot of connection with muscles, with teeth, with neck, with the rest of the body. And if we don't have a good biochemistry, we never will have a good rehabilitation. I am talking for dentists, for physiotherapists, for osteopaths, and also for doctors. All medical science have to understand biochemistries and structure go parallels. We cannot treat only one part of our body. Don't forget it. That is very, very important. Good rehabilitation is obvious. A good balance between the whole body. Okay, everybody, I hope you enjoy our transmission. Every Wednesday we will have different topics in our channel, in our socials. You can follow in direct, or you can listen after the video, because the video will be there for everybody of us. And don't forget, we have an application. Don't forget that. Our application is very good application. You have the link in this video. You have the link of our page and also in our application. Don't forget this application. You have a lot of things there. You have the news. If you go there, you have different courses, different videos. You have different things. REHABILITATION. You will have a lot of things in our application. If you go and register, you can click on it. You can go to sign up, put your email, your password, repeat your password, and you are in. Don't forget it. This is a special opportunity for you to have all the information of NPR. I hope you enjoy our video. Our 15 minutes is finished, and I will see you next Wednesday at the same time for all our socials. Have a good day, have a nice week, and I hope you enjoy our transmission. Bye bye everybody in our daily podcast in English. Bye bye everybody.